Hey friends, it's Ian Khan, the Futurist here at RSNA 2025 in Chicago, and I've got amazing conversations happening here. I've got with me Luanis from Philips, a company that we've worked really closely with, and I want to ask Luanis about some things that they've been doing. Luanis, welcome to this snappy session at RSNA. How is the event for you? Tell us about yourself. Tell us about what Philips is doing here.
Yes, so I think this event has been quite really big when it comes to the MRI business of Philips. So I lead, Yannis Panagiotelis, I lead the global MRI business of Philips. I've been in the industry for quite some time. I'm an MRI physicist by training. I have a PhD in MRI.
Wow.
And I'm one of these guys that happen to do what I studied. So I feel really privileged when it comes to that. So specifically, Philips this year, we have announced that we have developed, it's still work in progress, but we have developed working prototypes of a 3 Tesla Helium-Free MRI system.
Okay.
And the objective is to productize it in the very near future. Planning to have some initial installations already in 2026. I think this system is completing the Helium-Free portfolio of Philips, so between 1.5 and 3 Tesla MRI. And at the same time, I think it is transformative because it enables access to MRI in a way that it was never possible before.
Yeah.
At the same time, it is a system that it's not just a new MRI system, it's a new magnet, it is a full platform that it will enable the customers to experience what we call next generation sustainability. And what does it really mean, sustainability? It means not only a system that is protecting, let's say, a natural resource like helium, but sustainability also from the existence of the MRI business in the future, because helium is probably one of the fastest increasing price-wise commodities that exist.
Yeah.
Has increased many hundreds of percent over the last decades, and to the point that it has become extremely expensive to use MRI, and actually access to helium is becoming more and more a challenge in different places around the world. There are places where helium costs $50 a liter, places where it costs $120 a liter.
Yeah.
That means that the cost of operating and running an MRI system can be effectively prohibitive for many countries around the world.
Yeah. So is MRI at a breakthrough moment right now in the world?
This is exactly, we think that by the end of the decade, the Philips paradigm is going to be followed by all the other vendors. So we're leading this race. But I think it is really good news that this technology is becoming available, because that will, the MRI procedures are increasing almost 10% per year, 5 to 10% every year. And the demand is huge, and we cannot really meet the demand. In order to be able to meet the demand, we need to be able to offer MRI with much more flexibility to the customers, flexibility for installation, freedom to put it in a very high-rise building, put it in, relocate it between different positions in a hospital, or located in countries where it is or islands, for example, where it is very difficult to get access to continuous supply of helium.
Right. So healthcare is evolving like never before. A lot is happening, but teams, radiologists are under more pressure.
Yes.
We're hearing about Blue Seal, and I wanted you to tell us about how does that change anything? How does it reduce burden on clinicians, and what is it?
So in addition to, actually now this is a bit of a contradiction we have with what we're doing. So we are developing more and more technologies that are enabling our customers to scan more patients. And of course, we are talking about ever-increasing procedures, ever-increasing amount of patients, and the same, or in some cases, smaller amount of radiologists or technologists. Our vision is for the next 5 years, more or less, to deliver a self-driving MRI system.
Yeah.
Our primary strategy and developing technology in a similar way to a self-driving car, where customers can determine to what degree do they want to enable the self-driving capabilities of the scanner. So working towards this means that we have to enable significant degree of AI, not just the standard, what we call the CNN, convoluted neural network-based AI, but also moving to Gen AI. So we have collaboration, for example, with NVIDIA, another collaboration with Microsoft, where we're developing multiple foundation models that will enable the customers to actually move towards this autonomous MRI. Autonomous MRI means that I can manage more MRI systems with the same or with less amount of people compared to today.
Okay.
The other direction...
One second. Let me pause. Let me give me 1 second.
Yes.
Sorry.
Of course, no problem.
I had a glitch earlier and it stopped, so I wanted to make sure everything's okay.
Of course. So
let's start now.
Yeah. So one axis of our strategy is towards self-driving MRI system. The other axis of our strategy is towards quantification, more biomarker mapping, reliable quantification, and we believe that this is going to improve standardization, but at the same time it's going to improve outcomes. Actually, it also answers the same question, because the radiology departments are mainly based today on reading images.
Yeah.
We believe that if you actually get into numbers, it will become much easier for people also to propagate the data and the information in other ologies, but at the same time to be able to handle more patients in the same amount of time without necessarily compromising the diagnosis. I would say, just to simplify it a little bit, that, or giving an analogy, in the past in microbiology, people were looking at a microscope. But today, everything is coming from an analyzer. This is within range or not range. Well, to some degree, this is also going to happen in MRI. MRI is a really powerful tool. It can deliver multiple biomarkers. Majority of radiologists are only looking at 5 or 6 today. We're talking potentially 100 biomarkers. And this will deliver something, the transformation that we see in MRI, or in radiology overall. Radiology or imaging today is an art. People are looking at images. Our vision is to transition radiology, or mix it up, or transition it actually, from being an art to being a science. Art to science, from images to data. And
is that the next evolution of the MRI?
Yes, I think the MRI is probably going to spearhead the developments towards this science world when it comes to this transition from images to data, because they're a really versatile and powerful tool, and it will probably benefit the most from the next generation AI developments.
Incredible. Well, thank you, Leonis, so much for sharing these few moments with us, the updates, and we look forward to hearing more about this and following developments with Philips. Thank you so much.
Thank you.
Really appreciate your time. Thank you.